Welcome to the Nerve Guys podcast, where we discuss movement, performance, and rehabilitation through the lens of the brain and nervous system. The Nerve Guys podcast is hosted by Gareth Kelly and James McCambridge. To find out more about the Nerve Guys or to book into our online or in-person training programs, please visit thenerveguys.co.uk. The Nerve Guys podcast is sponsored by Elite Vision Sticks. Every day, athletes of all levels are reaching their full performance potential with Elite Vision Sticks. Pick up yours today. All right, so today we have a guest with us. We have Beth from Flexibility Matters. Beth is a physio who works both with NHS patients and performers and athletes, as well as having a bit of an athletic background herself. Probably what's best. Beth, hello, first of all. How are you doing?
Hello, I'm doing well, thank you.
Yeah, take us through just a little bit about what you do. So, kind of, what is your job? What kind of people do you treat? And what's your background? How did you get into all this?
Yes, so I am a physiotherapist. I work for the NHS in a specialist service and the chronic pain service. So the patient that I mainly treat is anyone with pain, literally from more than 3 months that doesn't go away. So I don't really see any more what we call the acute pain. So I don't see as much of the fractures, the sprains, that sort of thing. But I mainly help people to manage the long-term pain. So such a long-term low back pain, chronic regional pain syndrome. So age-related or arthritis. So that side of things as well. That's what I do as the main job. From kind of the reason I always like physio is because I really like the human body. Being like an ex-gymnast, also being an ex-cheerleader as well. I used to do a lot of sports. So that got me really interested in biomechanic and how the body works, and also very, very interested in flexibility. With that background, I've started Flexibility Matters. I wanted to promote kind of pain management and also kind of how people can optimize the body through stretching and how they can move in a pain-friendly way. So that's a bit about me. I've also, outside of work, worked with Team England Paracheer before as a medical officer. So that's more kind of the pain management within the team. But I also, within that team, do acute sort of injury management as well. So if people have an injury during training, such as we had a few sort of back pain during training, wrist pain, shoulder dislocation, or even kind of like the emergencies of passing out, seizures, attack, concussion, that sort of thing, I also deal with too. So that's my background. Do a bit of acute, a bit of chronic, and so that's kind of sums it up. Sorry, sounds like I do a lot, but but mainly those two things, because I branches out a bit.
Yeah, you've kind of got the whole spectrum of, especially pain. Yeah, I wonder as well.
I know. So to me, anything related to pain and injury, that's kind of my interest. And
was that anything in the background as well? So I know for myself and Gareth, I find a lot of people when they have a gymnastics background tend to want to know more about the body, and I always wonder, like, for some people it's just because the gymnastics gets boring and they sort of go, yeah, you know what, I'm just used to doing it. I've been doing this since I was a kid. I want to know more. And then for ones like, I guess, us, we just get injured so much that it becomes like, which way around?
I think you're right about that. Loads of gymnastics people go into like coaching and the body stuff because we're just naturally interested in it, isn't it? I think for me, it's a flexibility within gymnastics and cheerleading. So loads of people say, oh, I'm injured because I'm hypermobile. And then that used to really throw me. So like, what do you mean by that? Why is that person more flexible than the other person? Surely are they born more flexible? And with a really competitive gymnastics self, you wanted to learn more and crave for that knowledge. So I think that's what got me interested in flexibility and pain, because hypermobility, sometimes people get pain and then people blames it on the hypermobility. but actually is it even hypermobility, or do they just not been training properly, or they're not very good at joint awareness training or strength training, that sort of thing.
Is there some kind of threat there that the brain's holding back, or is it so unstable that the brain's a bit scared, so it's generating the pain signal? You know, a lot of
exactly.
A lot of people that used to be, say, like gymnasts or performers, to get interested initially in the biomechanics and or the neurology stuff or anything at all that might give them that extra 1% to get that little bit better. And then it opens up the door and you go, oh God, there's all this other stuff.
Yeah.
And then you kind of go down the rabbit hole, I think, and you get further away from trying to increase your performance and closer to the actual just wanting to learn more about the body in general.
Yeah.
That's how I generally found it through trying to get better. And then I got to it just actually being really interesting.
Yeah. I think it's actually really interesting as well. The more I find out about this, more the body and brain connection when it comes to training. That's how I feel anyways. And if you understand that your body is safe to move, that you're not doing any harm, then that helps you become a better performer, a better coach, a better clinician, I guess.
Yeah. It's all about options.
Yeah.
The more options your brain has
with
the body, then the less chance of injury you've got, the better chance of recovery you've got if you are already injured. And it is that kind of brain body connection. Just keeping that alive and working is really, really important. Because I don't know if you find this, but when I'm treating people in person, I find they generally have their awareness of that brain body connection slip. So they kind of detach from the body.
Yes. I don't know whether because I'm in the physio background itself, so I've always encouraged that body connection, but it's shocked me how many people are unaware and disconnected to their body. They have no idea how the body works. And with gymnasts, a lot of the training that when I used to train, I'm sure every club is different, but it's very much like do this, do that, and practice, but you don't have that control. It's about like what your coach tells you, and you follow the program and you just do as you're told. So because of that, like my body didn't actually, thinking about it now, my body didn't know what I was training, and I wasn't training smart. I was just doing what people tell me to do. So I was a bit disconnected back then. And now that trying to reconnect with my body, then I realize how much more I can do. And
so I wonder,
it is important.
Absolutely.
Just thinking about that, like, how do you find the difference there between gymnastics and physiotherapy, where, like, in gymnastics we just sort of say, do this. Physiotherapy actually has to kind of have some reasoning or proof behind it. Like, you do something because your coach tells you to, and then those people become coaches, and then they teach the students, this is the way I do it because my coach told me to do this. And that doesn't really work in medicine. Like, if I said, oh, you know what, I've got this really great treatment for you because my doctor before me, here's some leak. Worked really well before, and nobody really knows it, but like, what's the difference there between the gymnastics? Like, do you find in physio you just have to know more about why you're doing something before you do it? Or
yes, you're right about that. So because as a kind of regulated body, as a physio, everything we do have to be clinical based, so you have the clinical reason why you do it. So even if you do a treatment, you will need to reason why, like, is it because you've learned about this research, and have you read the most latest NICE guideline? And then there's a huge thing about safety as well. How can we make sure that that person's safe from the treatment? And I guess there's also about the perception of physio. So traditionally, people think physio is very much hands-on and giving people massages. So loads of first impression is, oh, you're not, that's the treatment approach. But actually, in the more kind of the modern physio or the newer physio, it's a mixture of both. So we see the place of hands-on treatment, giving people that therapeutic approach, but also if you want to get someone better, you need to help them understand why they have pain, understand what can they do to make themselves better, understand holistically if the patient is, you might question, oh, why is the patient not getting better? But sometimes it's not always about the treatment itself. There might be things outside of physio, like if they're not sleeping, well, the pain's going to change. So if they are stressed, the pain level is going to change. And if they're working, they can't change the way they work, and then that will also in itself cause pain as well. So the patient can get really complicated. So I guess that's different, I found, with being kind of working with athletes and NHS patient as well. NHS patient can get very complicated, and then that will require more kind of a multidisciplinary approach with psychologists, occupational health, and pain doctor, pain nurses as well. Whereas athlete, they tend to be a lot more driven. They just don't know how to work their body. So if you can just find out that, then that in itself can be a session.
Yeah.
Sorry, that I went off the tangent a bit. I was trying to compare it.
Don't worry, brought 3 great points.
Yeah.
So point number 1 is basically like, how is your understanding of how important is the understanding of how chronic pain versus acute pain treatment works with patients. So how you're going to approach it with Joe Blogs off the street, as opposed to, say, Premier League footballer, for example.
Yeah.
It's going to be completely different because, as you say, like how driven they are and how in tune with their bodies they are already, probably. It's going to be a different approach. That was the first thing. Second one is how important intent is, and understanding of where their pain's coming from, and intention behind the rehab, because you'll find people do check out when they do rehab, and they don't actually progress quite as much as people that are invested and they're paying attention.
Yes, absolutely. Yeah, it's about the goal, isn't it? What do they want to achieve?
Yeah, and the brain, as we all know, the brain itself won't really change that much in an adult without certain effort. And then the third point, which we might get to, is it also brings up a really interesting thing I was talking to James about earlier. When somebody's in pain, it's always the bad days that you remember. It's the bad days that stick around, because the pain stops you putting your socks on. The pain stops you, tying your shoelaces. It stops you doing all. But on the times that you have a good day, you don't recognize it because it doesn't stop you doing anything. So, and that's something I find that you have to try and get across to a lot of people, is it's bad days that stick around.
I was wondering, well, what came up from that for me was about what you were talking about, pain levels changing, and explaining to people that, if you don't sleep well, it's going to change how you experience pain. And I think there's a lot behind that. Maybe we could try to unpick a little bit for anyone listening who's going, first of all, either what do you mean? Like, if my hand's injured, it's injured, so how is my sleep going to affect that? Or, as somebody who deals with chronic pain, could you talk through a little bit about how exactly it works, just for anyone who I'll lightly touch on it, because this can be another hour just talking about sleep and pain in itself. It's quite a big topic. But going back to what Gareth said earlier, like, a really resonating echo, that I can hear what you're saying. So on the good days, you don't realize it. People push themselves, and then the bad days become even more worse because they've been pushing themselves on the good days, but not appreciating the good days as well, presumably. The bad days are really bad. That in a way sometimes links into sleep. So let's just say the good days, you're doing a lot, and then you don't feel the pain because the pain doesn't come straight away. It comes afterwards. So the after effects start to come on the evenings. And from a science point of view, and a body kind of hormone changes point of view, inflammation point of view, that sort of achiness, that sort of pain generally comes after. So we get a delay onset of pain. So then when you're more likely to experience pain at night time. From an inflammation point of view, your body's inflammation is more active at night time. So if you have an injury or an old injury, that inflammation comes up higher, and then that joint gets a bit more warm and more swollen. It doesn't like it. It will produce pain. Then that's another factor that can affect your sleep and affects the pain level you experience at night time. And undoubtedly, the worries and the anxiety that comes with worrying about the pain, people, when they sit down, when they're in bed, they tend to worry more. And because you don't have other things, some people call it distract you or keep them busy. And that worrying brain in itself can make people finding it hard to sleep.
So all these factors add together will make people struggle to sleep well. So they might not get a refreshed sleep for 8 hours, let's just say. So they might be waking up in the night because they're uncomfortable, because they're in pain, because the mind's worried. And as a result of the next day, that becomes a bad day because they didn't sleep well. So I'm sure with anyone who doesn't sleep well will not have a good day. So if you add pain on top of it, that can amplify the pain you experience. It doesn't mean your pain's getting worse or your injury's getting worse at all. It just means your experience got worse because of the factor that caused lack of sleep.
You're already worn down by all these other little factors. And
yeah.
the same pain level seems a lot more intense just because you're already worn down.
Shattered, yeah.
Exactly. And same thing, as you say, when you're lying in bed, the pain can feel a little bit more intense because the inflammation, there'll be more of it at night time. You're sitting down, you can have time to worry about it. And that's why you'll find a lot of people that say they've got bad backs, they turn around and say, but turning over in bed when I'm lying in the middle of the night is really, really different. And it's because you've got time to focus on the sensation. You're doing stuff and you don't really focus on it as much.
Yeah. And when you're doing stuff, you're moving, you're not having all that tension building up. But when you're laying down, the body's seizing up as well. So if you sat down for long, your pain gets from stiffness and tightness, and that in itself can lead to pain.
Exactly. You're compressing the muscle when you're sitting down or lying down, so you're not getting the right amount, like the full amount of flow, etc., that you're getting when you're walking, all that kind of thing. But it's a difficult topic, I think, sometimes to broach with people.
I think it's a very big topic as well, but not everyone's accepting to open to talk about that.
I think it's a very because it is really sensitive, I think, with people, and a lot of people don't want to hear the answer to being move more. For a lot of things, because it help, and a lot of people are like, no, I don't want to.
The traditional joke is, isn't it, the doctor, it hurts when I go like this, and the doctor say, well, don't go
don't move it.
That's it seems a bit too simple.
Your approach now, whenever you're with patients, do you now, this is going back a while now, I used to have a physio friend, and his approach would be purely biomechanical, make sure the joint has range of motion, make sure all the muscles around it are working properly, all that kind of thing. Do you treat like that personally, or do you treat as a whole organism, or a combination of both? So you take obviously in the brain body connection and stuff. Well, I can tell that you do from what you've said already. But generally, does it change much now for your professional athletes and your like Joe Blogs off the street kind of?
I think the question actually goes back. It depends on the patient. So I think I do the mechanic side of things, but I found that that's only kind of a small portion. So let's just say the things that I can do, it's because there's a variety of things I can do. So it's like I've got this book of things that I can pick up and treat the patient, and biomechanic is definitely one of them. And that's kind of the bread and butter from physio anyways to start with. So, but what I do, eventually the goal is get people moving, and if they move, the pain gets better. But what I found is to get to there, sometimes it requires that holistic approach. So if people are still kind of worried about their pain, they'll never let you get to the biomechanic side of things to look at how can you work the shoulder more efficiently, how can you move your hips, knees and ankles better. So I guess, so it just depends on the patient really. It's very patient dependent.
And does the amount of time you have with patients, obviously, it's really restricted because it is time sensitive because they're only getting an appointment for however long. Say it's 6 weeks worth of once or twice a week or whatever it might be. I take it that has a big effect on how, not so much how deep you'll go into things with them, but how you approach things, because you're obviously looking for the biggest bang for buck to try and get them on that journey started. So again, there's different factors. So when I work on an acute place, so before I was a pain specialist, we used to only have half an hour. So when you only have half an hour,
like you say, you can't go so deeply into things, but that's okay for most people if they have what we call the acute pain, when they just have an acute injury, want some advice and carry on with life. So that's okay when it's half an hour. It's more the complex patients. So if patients have multiple medical histories, they don't only have back pain, they also have wrist and shoulder and ankle pain. Those patients, I think I'm quite lucky being a pain specialist service. I do get 1 hour for the complex ones, so then I can unpick what's happening biopsychosocial point of view. So the bio, it's the biology, so how the body moves, the biomechanics, the muscles and joints, the bones. Then the psychosocial is what's happening social at home, work, and the social life, the support network. And psycho, it's kind of their fears, worries, and anxiety. So I'm lucky in a way that I can get 1 hour to treat those complex patients, but I appreciate actually most physios in the UK only get half an hour, and it's really hard to unpick those. So those becomes kind of like, if I don't have enough time, I think those are like little nuggets. So instead of throwing all the nuggets at one point, I'll pick what feels most relevant and just plant the seed and and perhaps if you have time, we can look at that next time, that picking the priorities to focus on.
Yeah. And then with that biopsychosocial thing, you kind of mentioned before about, sometimes things can sit in different departments as well. So it might not just be a physio at one person. It could be, psychologist, neurologist, any number of other specialists. How does that stuff work in terms of, like, obviously I imagine everyone's very good at notes and sharing in the medical profession, but does that leave, what am I trying to say? Does that leave scope for things to get missed because you assume, the psychologist is supposed to deal with this bit, so I'm going to leave it out and I'll wait for that to happen? Does stuff ever get missed out, or how do you manage that when you've got a bigger
I guess missing out is quite, I guess it would just find out what's most helpful for the patient. Obviously, knowing my scope of practice, how far I can go from a physio point of view, can't really separate that mental health and physical health. So if someone's in chronic pain, sometimes they get depressed and anxiety because as a result of the chronic pain. So if they only see a psychologist, the psychologist can't help with the body movement because that's not what they're trained. They can ask them to go for more walks, but there's only so far they can go. So I guess it's just recognizing myself as well. Although I have some training in what I call accept and commitment therapy and ACT, but there are patients that will be really stuck. Maybe they have like a personality disorder, and knowing that my limitations, if they're bipolar, ADHD, there's only so far I can go. So if I can't do certain things, and I'll seek advice from the psychologist and discuss with her, is there anything I can do differently, or is there anything they would suggest, or would they see this patient? The same with the pain doctors. We have a MDT meeting, which is multidisciplinary team meetings that we can bring up these patients just in case if there's something you just feel, oh, what if I missed this? Or what if the patient would benefit from this treatment? Then we can bounce off ideas. So we're trying to minimize things being missed, I guess.
It's nice to see that kind of, how could you put it, combined arms approach. Because it is better for the patient in the long run. But speaking about standard chronic pain, I want to touch on very quickly chronic pain in your athletes and your performers, because the problem I've always found with athletes and performers, and like some of the football players we would see and stuff, is it's quite hard to figure out when it is chronic pain with those types of those types of athletes. Because chronic pain for a standard person in the community is a lot different than a professional athlete's chronic pain, because they not ignore it, but they're taught to accept it as part of it. So you might not even know that they're actually in pain initially. Yeah,
I think sometimes that's a barrier to treatment, or a barrier to do helpful things for those people, because if they're an athlete, or if it's the job that they have to do, so they either hide pain or they push through pain. I definitely, not naming who, but I can think of on the top of my head that it feels really uncomfortable as a physio, I guess, or as just a human to think this is not good for you, but I can't stop you because it's her choice. It's your choice. And it's really, really hard. And I guess it's just noticing that in myself and said, maybe there's nothing I can do. I know this will help, but if that person's not ready, they're not ready. It's so hard in the I guess in the sporting world, it's really, really hard. But it doesn't mean that, again, it's the planting the seed, isn't it? It doesn't mean we can't plant the seed, and it's entirely up to them how they want to grow with that idea. And you also mentioned about differentiating acute and chronic pain. So in the medical world, there's a thing we call red flags. So if there's specific signs and symptoms, or if there's trauma that's not quite the same as the pain previously, then you can kind of rule it out, and then you can differentiate whether it's acute or chronic. But that tends to take at least a good 15-20 minutes of assessment to really, if you want to be absolutely sure, to pull it out whether it's the chronic or the acute. But it's important to know sometimes, so you're not causing more damage, etc.
I find as well, actually, just when you're talking with athletes, or actually with general population as well, people don't think they're doing things enough, or they don't think they're pushing hard enough unless they're in pain. So if they're
like no pain, no gain.
Exactly. That mantra is being cemented into everybody. I blame the 80s movies. But everyone's got that cemented into their head. So if they're not in pain, they're not working hard enough. Whether it's just going to the gym or going for their 5K runs, or whether it is footballers, swimmers, whatever. Everyone seems to have this now social burden to try and push as hard as they physically can.
In the athletic side of things, that's almost like this resignation thing as well, which was something I'm going to ask you about. Like chronic pain in the general population, in my experience, people, like the biggest barrier for me is just, they say, this is just how it is, like that, there's
they don't believe there's hope for change and room for change.
And in circuit where we're both from, not so much resigned to chronic pain. Anytime there is serious pain, they want to fix it, but they're resigned to the fact that they're supposed, I'm a circus performer, I'm supposed to just hurt all the time. Like that's I wouldn't be doing it right. I wouldn't be a professional performer if I wasn't aching, slow moving. And do you have kind of protocols for because I guess that's got to be a pretty hard thing to win somebody round or get someone out of that thinking. Do you have any strategies or techniques or anything that you use for that?
Yes, I can. So just to make sure I'm hearing the right thing. So it's about sort of performers, kind of that mindset things, and what they perceive themselves and how they feel they should be. So that's really challenging to challenge, because that's someone's thoughts and someone's belief, and it's really hard to change someone's thoughts and belief. It's if society, the culture, and people around them, all things, this is how it should be. So sometimes some people will use what they call a CBT approach, which is identifying what the thoughts linked into the reason they do things, what they see people doing, and what they would feel. So sometimes you can just unpick that cycle of questioning in a non-judgmental way. So just kind of, instead of saying, oh, you're wrong, but it's about kind of being curious and open and really question their thoughts. So if they question their thoughts, sometimes that can create some conversations and some extra thoughts and extra thinking. And then they might be willing to start thinking about doing things differently. So it's not about necessarily changing the thoughts. It's about being more flexible in expanding the thoughts. It's quite abstract, but that's kind of the way I think about it. Because I don't like to be confrontational.
No,
you don't go anywhere.
I would agree. I think, especially after I was injured, I did all my rehab and did everything, but I was still in pain until I looked at it from more of a sort of neurobiomechanical point of view. And why am I sore? Why would the brain feel under threat? To keep me in pain. The injury had healed, but it was still there. And I didn't really start making any changes until I started approaching it from that.
Yes.
That is always constantly if you don't get up sore in the morning, you didn't work hard enough the day before. My coach would go, how are you feeling today? And if I said okay, they were like, well, you didn't work hard enough, and give you more stuff to do. So it took a long time to get out of that mindset. But it wasn't.
It's like it's a mindset of cycles, and you're in that cycle of mindset. So to get out of that cycle of mindset, you kind of need to find your way out. And sometimes that's quite difficult, but
I guess one of
it's one of those things you just need time and a lot of trust between, I guess, your client and the person you're working with. They have to believe in what you're saying is true. I guess for you, Gareth, you know it's true because you experienced that yourself. So you went through that journey, but for the other person, they might not have.
Exactly.
But then you can't think of that, like if you get the next person that comes to you, you can't go, oh, it's fine because I went through it. Like that's not always enough. The advantage we have is that somebody's already come to see you, so why would they come see a physio? Why would they come see why would they come see us if they didn't believe it was possible to some degree? Whereas I think the people that all of us really miss are the ones who are just out in the world.
For sure,
This is me now. I'm just like this, and even if I did believe it could change, I'm fed up of trying and failing, and actually I don't like it.
That's the ones that you want to get your hands on, but obviously because they come anywhere near us, we kind of don't get our hands on it then.
So one of the things I wanted to ask as well was how you deal with the idea of like educating people about pain. So you sort of said like actually one of the important things is for people to kind of learn how things go, and one of the things that I think we all know is really tricky is broaching this idea of the sensation of pain living in your brain without to not have that come across as this is all in your head, or to say actually we're not trying to say this isn't real or anything, we just want you to understand how it works. Do you have any kind of procedure of how you educate someone about pain? Is there any protocol for that?
The answer to that is there isn't a set protocol in terms of how do you approach pain science to people. We need to just be mindful that if we just teach and tell people things, people won't go back and learn and absorb. For a learning process to happen, you have to kind of communicate, and the person you communicate to also need to absorb that information, consolidate it, understand it, and then giving it back out. So if you just tell someone to move more, they're not going to move more if you don't know why it moves more. But linking that into how do we start by having these conversations about pain, it's more sometimes how you think and feel will affect pain in itself. How do you approach that conversation? Because it's quite a unusual concept for people to understand in the first place anyways. So I guess I sometimes do a thing called like creating hopelessness. I don't tell the patient that because it's quite a depressive name, but in ACT there's a thing called creative hopelessness. So we go through, what have you tried? Has it worked? No. And what have you tried? Has it worked? Or maybe how long does it work? Okay, short term. How much does that cost you? Quite a lot of money. Generally, that's how people go through the treatment. And they ask them, so anything works in the long term? And they say, oh, nothing works. So they go into a mindset of, oh God, there's literally nothing else I can try. This is it. What do I do now? And in that sort of state, and then you can suggest that idea of, would you like to hear an explanation of why you feel pain, although in your x-ray it's the same, although the doctor said there's nothing they can do, why are you feeling pain? And then they'll start, if they say yes, always check in with them first. If they're willing to learn, then then I'll start explaining perhaps there's something more to just biomechanically something wrong with your pain. There's perhaps the way we think and the way we feel impact pain. An example that I sometimes give to people is if they're not been moving a lot, then I said, how long can you sit before you get pain? So just being curious, and again, not judging them, just ask them, and the curiosity, just ask them openly and said, how long do you sit before you get pain? And I said, 30 minutes. So what's going to happen if you only sit for 15 minutes? Oh, my pain's not as bad. And so what does that say about your pain? So if I sit longer, my pain gets worse. Okay, then you create a bit of conversation and coming into movement. So that's one way. And the other way, similarly, you can do the same of, I'm noticing that I feel really stressed recently and my pain gets worse. And then you question, so why do you think when you stress, your pain gets worse? Or maybe because, I don't know, just everything's just tight. Okay, where are you feeling the tightness? And then exploring that. So I've kind of like put some baby step and nuggets and slowly branch it out into pain science conversation. So that's my approach. I don't know, do you guys have your own approach? Because I think everyone does it slightly differently.
Yeah, I'd say, me personally, whenever I work with someone face to face, it is quite similar. They have to be ready to hear it.
Definitely, yeah.
With pain, it has to be, you need to lay a trail of breadcrumbs and wait for them to be ready to follow the trail of breadcrumbs. And it's just, no matter how much you tell anybody, it still amazes me how influential the brain is in creating the sensation of pain. And I always tell people the story that we heard on a course before about a builder fell off a ladder and a big needle through his boot.
The needle story, yes, and the needle wasn't even in the shoes.
Yeah, not even through the skin, but feeling the pain because they could see it. Yeah. And I always use that quite often with patients, just to kind of help them understand that there might not actually be any physical damage, but the sensation is real. The sensation of something's causing it, and it could be lots of other things. And that usually opens the door a little bit to them going, oh, really? Well, what about this? What about that? So it would be similar, I think.
That's a really good metaphor, actually. Yes.
Yeah.
Yes.
Yeah. I mean, I love your way of having, because you kind of get them to come up with the answers of how it works themselves, and then all you need to do after that point is confirm. Yeah, actually, the literature sort of confirms what you just told. Yes. So
yes, you're right, and validating, and then they suddenly feel, I've got a bit of information now that I can work on.
Yeah, exactly. I mean, the only thing I do extra to that, I've got a little comic I like to give people. It's called "Pain is Really Strange." Can't remember who it's by, but
please tell me you drew it yourself.
I did not draw it myself. There's a whole
oh, damn it!
Comic strips.
Disappointed.
And it's quite short. It's like a graphic novel that just talks a little bit about pain, because one of the things I find is people tend to be more receptive to information if it's not a face-to-face thing. When it's face-to-face, it sort of feels like a dominance thing. I'm telling you this information because I know you, whereas if you read a book, then you can read it if you want. Well, it's the same stuff I would have told you, but you get to find it out for yourself. You get to, in that moment, choose whether you agree.
Yes, it's like, this is what you can offer, but they have to agree to read the book or
and they
work together.
They can set it down and go, I'm not ready, and 2 days later they might pick it up again. You know, because face to face, can't come back and ask you another question about it, really. But if it's and it's almost like the same as Coca-Cola would do, like, you know, brand awareness. You just pass it all the time, so it's always there. Maybe it is worth a try. Bringing on to that though, if someone is suffering from pain, chronic, acute, doesn't matter, at what point would you advise them generally to seek help? Because, as you say, we have to be ready for them to take that step and follow the breadcrumbs of understanding where their pain is coming from, what's causing their pain, and their steps to recovery. But when would you sort of, if someone's coming to you saying, I don't know, I'm a gymnast and I've got to meet, and I need to train, but I'm suffering constantly. I'm constantly hurt. I've got a busted wrist, and it just seems never better. I've got it strapped all the time. Well, so for you, well, sorry, for me, I would personally say when it starts impacting, when it's a constant thought, when it's always there, when it impacts what you're doing, when it impacts what you're doing when you're not training, when you are training, your sleep, when it starts to impact anything, I would say, we want to seek a bit of help instead of self-managing. I don't know what your thoughts on that kind of thing.
Yeah, I think it depends on the person. Well, from our point of view, of course, the earlier they seek out, the better. Because if that sort of worrying thoughts start coming, and then they start to train differently, they're compensating because they're trying to train, but they're pushing away from the pain, and that's not helpful in terms of if they want to get a more efficient training or get the best performance out of themselves. So I would say the earlier the possible. That would be my thought. But again, it's up to the person whether they would want to approach us or you guys, or whether
I guess that's the balance for people is always the cost effectiveness of it. So you're on NHS and you can get it for free, but you have to pay for every time you go. What would you recommend for someone who's going, well, what kind of signs should I be looking for where I go, definitely I need to see somebody about, like, I
think when you start thinking about it a lot, then definitely you need to work seeing somebody. Because if it's just niggling and you're kind of going away in a few days, then that's okay. But if you start worrying, I think that's when things can build up. The later you seek help, and that worrying builds up for longer, the way that it's just not, maybe perhaps it's not helpful strategies that you're using. If you're trying to self-manage but you're still worrying and still struggling, then I would say definitely seek help from someone. That would be
I'm a big believer in the adage of flirt with discomfort but never give P in your number. That's if it's uncomfortable and you can work with it, that's fine. Discomfort isn't anything really to be scared of. Do mistake discomfort for pain. When it actually refers to proper pain, it generally, it's pain. And that's when you need to then change your approach, because you don't really want to be training into pain.
Yes. And definitely, and also acute pain. I think I didn't admit that, but if you have acute pain, then you definitely need to seek help. Because that could be something more serious, like a fracture or stress fracture, or medical attention is required. So
So pain and injury treatment. So we generally see probably in the next 5-10 years that a lot of pain and injury treatment will be a good blend of biomechanical and neurology based. So a lot of it will be, brain based, because there'll be a lot more kind of sharing of information about, where pain comes from, sensory and motor approaches to help pain. Where do you see that going? Because we kind of see it going down that kind of blended route.
I think more and more is coming onto the table now. So when I started my training, it's about 5 years ago now, it's very different. I think it was a lot smaller as well about these conversations. If you look at 10 years ago, I don't think people even think about training pain differently using like motor, sensory, and things like that. But because of the research that's coming out from a physio perspective, people are trying different things. So I know I went to a pain conference recently. It was run by Laura Monosley in Australia. So they did a virtual one, so I can join in the UK. I didn't fly over to Australia during lockdown. So they've shared some really interesting research and articles about kind of along the lines of what you're saying. So one of the things that they did is put patients on virtual reality, and then they train the body, ask them to do movement or certain tasks. And I can't remember what the exact research is, but they're using that as an idea to help people to retrain pain and relearn about the body and the pain. So I think there's definitely a lot of space and room for growth in that area, and if more people are aware of it, and hopefully that will be a bit of the future.
I think it's that kind of old adage. It's the same with vision training. Used to be, once something like a big football club or something that starts to invest in it, you'll see the research in it just going jump, jump, jump,
jump, jump, jump. Yeah.
Unfortunately, it is whenever big private like sports clubs or anything really want to invest in it, that you will see that filter through.
Yeah.
More interesting.
I think if they reach a point that if they're doing all the things that they're not really getting anywhere, then they'll kind of look out for more other alternatives. Because there's only so long you can ask someone, and then what? Then you need to move on. So what can you do to move on? Let's try all these other different things.
Yeah. And then just filter out the ones that don't work and the ones that do work. As Jay's said before in another podcast, it's like my magic crystal is better than your magic crystal. Drop, and the other ones that do work get adopted.
Yeah, or unfortunately they don't all drop. They kind of just hang around.
Oh, well, yeah.
Hang around. Floating.
I spoke to a hand balancer recently who gave that analogy of just, all of those kind of homeopathy, magic crystal energy stuff. The reason that they hang around isn't because they work, and they haven't gone away because they don't work, but they just don't do anything bad. Like they're not causing any damage, I guess. Major harm. So actually, they're sort of free to just exist,
carry on.
And to be fair, if it helps people feel better, then there's no harm in it to a degree. It depends how.
Yeah, true.
Then it depends how much trust they put in it, that they don't actually seek professional help.
And also there's something about placebo effects, mind again, going into the mind. So why does placebo effects work, and why does certain things work because people believe it works? So the brain in itself starting to produce chemical changes to help the process. So
exactly, it's one of those things. Every avenue you go down in these conversations could be a podcast or an episode, or it could be a textbook on its own.
I'd really like to do an energy healing placebo podcast at some point. But
I think you just get really angry the whole way through it.
I don't know how I can sit with that one.
I'm not sure.
Once I figure out how to make it interesting.
I don't understand this. But sometimes I think if you move, like if your body is in pain, you protect, you get tight. But if you're welcoming to move, you're moving arms up there, and then your brains do this as well. So when your body's tight, your brain gets tight, and then you don't think you're rigid. But if you're willing to start move your body first, and then your brain starts to become more creative, and
that's it. The more you move in general, I think the better.
The better.
And, especially if you are suffering with pain.
Speaking of which, though, we are coming up towards the end of our time here. So just before we have to go, I wanted to first of all ask you if you had any cool resources, reading anywhere, if people want to learn specifically more about pain. You mentioned Lorimer Moseley, which I think probably for myself and Gareth is kind of read Explain Pain, read Painful or anything like that. That's a really great resource. Are there any other ones that you would encourage people to go to if they wanted to learn a bit more about kind of pain education?
So I think the Lorimer Moseley one, Dave and Butler, they're like the big, they're just really famous in their field, isn't it? So if you're into that, then go look at that for sure. In terms of more kind of people, layman term, easy to read, there's a website called Retrain Pain. So they've got little slide shares. Have you heard of it before?
I've heard of it. I've never visited it, but I've heard of it.
Yeah. So it is quite simple, and they say, pain is like a smoke alarm, that it can amplify or it can get quieter. So it depends on the sensitivity. So again, it's just a little examples. They touch on gold and sleep and I can't remember. So I think that they just have little slideshows for people to understand a bit more about pain. So that's quite a nice one if you don't have a lot of time and just want to browse around. Another quite useful one that's if for people who have chronic pain, it's called Living Well with Pain. So I think it's a charity. So it started with lots of people who have chronic pain came together. They've made this thing called 10 footsteps to living well with pain. So it's little ideas that people can try to manage their pain. So they've got advice on sleep, they've got advice on pacing, activities, medications, so all sorts. So those are quite nice ones that I would recommend.
Yeah, cool. And then the final thing, I guess, is if people are interested in your services and want a physio that is a pain specialist to come and treat them, where can they find you? I know you've got Flexibility Matters on Instagram. Is that the best place to get in contact with you or check out your stuff?
Yes, my Instagram is probably the easiest place to find me. I'm on Flexibility Matters, so it's a bit of a blue logo, so it's quite easy to spot, I hope. So just send me a message, or that will be the easiest way, or you can contact me on my email as well. I do have a website, but I'm thinking about changing it, so don't contact me there yet. Just contact me through Instagram, easiest way.
We're well aware of the terrors of having to do a website.
Yeah. Cool. Well, we're going to have to wrap things up there. But Beth, thank you very much for coming and talking to us about pain. That was very insightful, really nice to get your thoughts and the thoughts from a trained physio about your approach to both chronic and acute pain and how you manage it. And yeah, I think that's
lovely speaking to you.
Yeah, it was very nice. Thank you for having me.